we need to look at stem cell technology. If we're going to look at the future, we need to very briefly look at the past, just to set the scene, really, because bone marrow transplantation started back in 1956, and that was the start of regenerative medicine. It's not really, it wasn't at that time considered regenerative medicine, but it is. It is stem cells being used to regenerate the bone marrow. So that's when it all began. So it's much older than some people imagine. And then we have all those other stem cells there, which were subsequently discovered. Peripheral blood stem cells, which are effectively bone marrow stem cells, just which have been liberated or freed from the bone marrow itself into the peripheral blood. Cord blood, I'll mention a little bit on that as we go along. Embryonic, mesenchymal, induced pluripotent stem cells and transcription factors. All of this stuff I'll give more detail on as we go on, but I just want to sort of set the scene. My own input into this was actually when I started my PhD in 1983 at Cambridge University, Churchill College, and that little picture there is the good old college with a Henry Moore artwork in the front there, quite famous around Cambridge. And I worked on mouse embryos, and Bob Edwards, my supervisor, who actually produced an enormous amount of work on stem cells, even though he's very famous for IVF. He published considerably on stem cells and was very, very knowledgeable. He supervised a PhD, and my first paper was there in 1987, and there were 2 or 3 others, I think, from the PhD thesis as well. So over the years, I've worked on pretty much all stem cell types apart from human embryonic stem cells, and I'll mention those a little bit more as we go along. And then in the introduction, we did mention the book. Every presenter has to mention his book. Mine's out just now. And the purpose of this really is not to provide a textbook for stem cell scientists and clinicians. It's to give information to the general public. And why this is important is that the general public, first of all, have very little understanding about stem cells. So that's a bit of a problem. And secondly, the general public are prone to want to attend private clinics for treatment using stem cells. Now, this treatment is quite often untested and unproven, which is a big problem to regenerative medicine. And so it explains this to the general reader so that anyone can understand it, and it can start to address this problem that we have in regenerative medicine of people offering untested and unproven treatments. So that's out now. Great read if anyone's interested.